And if we look at this group of viruses, so the coronaviruses in general, and these RNA viruses, we know that there's variations and there's variability. If you look at kind of the family of all the viruses, they're kind of in between, they're kind of in the middle in terms of variations. So we've got very, very stable viruses like the measles virus that doesn't change very often at all. We have viruses like the influenza virus that we know changes very frequently, and you have to get vaccines every year. This group of viruses is somewhere in between. So at this point in time, I think we're still looking for, evidence. These are new vaccines we're putting out. There's obviously a lot of monitoring that's going on. It doesn't look like we'll be in the situation that we were in with the influenza viruses, where we will need a brand new vaccine every year. But it's a bit early to tell whether or not we would either need to change these vaccines, or if there's a booster that's needed. And if we do need a booster at some point in time, whether that would be in a year, 2 years, 3 years. So I think this is all the types of information that we're going to be continuing to collect, working internationally to collect that information, and monitoring not only the virus, but obviously these vaccines and how we move forward. If there is a significant change to the vaccine itself, and that can be on the clinical side, it can be in the manufacturing, then they would have to come back to Health Canada with a change. It depends on how significant that change is. If it's not a completely new vaccine, then they can actually submit data, and there's an addendum that's an abbreviated sort of process that we review, and we take a look at the data, and then we can make that change. And then if there's any change that's made, that's reflected in all the product monograph and all the labeling as well. So yes, so if there is a significant change to the vaccine, they would have to come back and submit that data to Health Canada. We would review that and then make any changes. If it is a brand new vaccine, completely different, they would have to come in with a full new package of data.